Good afternoon, everyone. My name is Shannon Kupka. I'm a project manager working with the nursing home teams in New Mexico from Health Insight. I'd like to welcome you to our half-hour Hot Topics series. These webinars are designed to provide you great ideas on dementia care, behavioral health, and antipsychotic reduction strategies in a 30-minute time frame to accommodate your busy schedules. They are brought to you by the Qualis Health Insight teams from Idaho, Nevada, New Mexico, Oregon, Utah, and Washington, and sponsored by the New Mexico Healthcare Association and Qualis Health Insight. So we are super excited about today's presenter on exploring the root causes of mental health problems. Eric Collett, Principal and CEO of A Mind for All Seasons LLC, is a nationally recognized speaker, consultant, and dementia expert, a licensed residential care administrator, and a teacher at Boise State University and the College of Western Idaho. Eric passionately believes that lifelong learning is a key to finding powerful new solutions to significant challenges and has spent over 18 years changing lives through innovative dementia care techniques and leadership strategies. Eric, you may get started.
Okay, thank you, Shannon. It's wonderful to be with all of you today. I have to admit it's always a little bit awkward to do webinars and not see people face to face, and I wish that we could be in the same room together. But it's really a privilege to be with all of you and spend the next half hour talking about root causes of mental health problems. I want to spend just a minute right off the bat talking about mental health problems in general and the difference between root cause analysis and symptom management. And right now I'm trying to figure out how to advance the slide because it's not working like it normally would. So let me try this. There we go. Okay. So often when we're talking about mental health problems, what we're really talking about are symptoms. And if you talk to doctors that work with mental health patients, they will tell you that there's a whole list of symptoms that we look at for things like major depressive disorder and other sorts of mental health problems. And there's a great acronym that you can use to think of these symptoms. SIGE CAPS, S-I-G-E-C-A-P-S. And let's go through each one of those briefly. S stands for sleep disorder. So when you see people whose sleep is getting disrupted, that can be one of the factors in a mental health problem. I stands for interest. So people don't really enjoy things anymore. They become more withdrawn and not engaging in activities that they used to enjoy. G stands for guilt. And this can be guilt about everything. They feel guilty that they did something. They feel guilty that they didn't do something. They feel guilty that they had a particular thought. Energy is another one. So if you look at people with mental health problems, a lot of times there's this reduction of energy and they're losing their zest for life, it seems. C stands for concentration. People with mental health challenges have a very difficult time concentrating and being able to go forward with things and follow them through to completion. Appetite is the A in SIGE CAPS. And this can be either increased appetite or decreased appetite. Sometimes we see people gain a lot of weight when they have mental health problems. Other times we see them lose a lot of weight. Psychomotor retardation is the P, and that refers to people that are just moving a lot slower. Imagine someone very slowly sort of plodding through the room, and they talk slower, and their voice seems to be kind of flattened. So psychomotor retardation can be a real issue. And finally, suicidal tendencies. And if you have 5 of those symptoms for 6 months, then you can be diagnosed with major depressive disorder. Now, those are symptoms, and a lot of medicine's approach has been to treat symptoms. We look for medications that we give people, like antidepressants or anti-anxiety medication. Sometimes in mental health challenges, there can be hallucinations, visual or auditory or tactile hallucinations. And in cases like that, we may use antipsychotic medication to try to control some of those symptoms because it really disrupts quality of life for people. Root cause analysis is a little bit different. When we talk about root causes, we're trying to get down to the heart of why does someone actually have challenges that are manifesting themselves with the symptoms that we just talked about. So let's talk about some of the symptoms that we frequently see in long-term care settings. We might have someone that cries all the time. They just seem to be crying and crying and crying. You can walk up and say, "Good morning, how are you?" And they just burst into tears. Sometimes we see a lot of agitation. Sometimes related to that, we get a lot of aggressive behavior. Aggressive behavior is often towards someone or even toward an object. I remember one day when I was working as an administrator, I got a phone call very early in the morning, and we had a resident that had kind of gone off the rails a little bit. He was a TBI patient, and he started thinking that everybody in the facility were intruders in his home and they wouldn't get out. And so he started smashing things and broke a TV and smashed a bunch of glass. Fortunately, most of the other residents were asleep, and we were able to pretty quickly contain the situation. But aggression definitely comes up. Suicidal thoughts is something that we have to be careful about. Obviously, both in terms of our desire to care for people and what regulators want us to be doing, managing suicidal thoughts and suicidal tendencies is pretty important. Knowing how to respond to hallucinations is pretty important. Lethargy and lack of participation is something that we need to be attentive to. And we see all those sorts of things in long-term care situations. Often, we're just turning to medication to try to treat those symptoms, or we're turning to interpersonal kinds of techniques. And I spend a lot of time with skilled nursing and assisted living and home health and private clients working through those interpersonal techniques. And they can be very, very valuable. But understanding why some of these things are happening in the first place leads to a little bit different perspective and approach. So let's spend the rest of our time considering a few of these common root causes. For example, hormones play a crucial role in brain functioning. So when people have a lack of estradiol, estrogens, testosterone, pregnenolone, DHEA, those are a few listed on the slide. You could add other hormones though, like progesterone or cortisol. Even melatonin, believe it or not, is a hormone, and it plays a crucial role in the functioning of our bodies. And both our sex hormones and our neurological hormones have a huge impact on how we function and experience the world each day. For example, depression symptoms like frequent crying can be caused by lack of hormones. You get an 85-year-old woman who had a hysterectomy in her 30s and never did any sort of hormone replacement, and years later, she may be someone that sits there and just cries at the drop of a hat. My business partner is a nurse practitioner who has functioned as the medical director for different skilled nursing facilities from time to time, or assistant medical director, I should say. He's done psych med reviews for various skilled nursing facilities. And several years ago, he read research about the role of hormones in things like depression. And he did some research on bioidentical hormone usage that showed that it really didn't increase risk of blood clots because it wasn't getting flushed through the kidneys like a synthetic hormone pill might. And so he experimented a little bit. He had some patients that were crying a lot, and he did a little bit of low-dose hormone replacement, and the crying just stopped. And since then, we've used that with lots of situations, and we've seen amazing improvement for some. Lack of energy is something caused by a change in our hormone status. So doing some lab work to figure out where a person's hormones are and responding to that could be very valuable. A lot of people don't realize that brain fog and dementia is heavily affected by hormones. A lot of women have experienced what's called pregnancy brain, or it's nicknamed that, I guess. I don't know the technical name for it. But my wife went through that 4 times, and it's very frustrating when you're used to functioning one way, and then all of a sudden things aren't working quite the way that they used to. The Mayo Clinic years ago did some research that showed that women who had hysterectomies in their 30s and never did hormone replacement were twice as likely to develop Alzheimer's disease, because hormones are one of the things that disrupts the signaling in our brain when they are not at sufficient levels. Lack of hormones also leads to muscle mass. It gets lost and people start wasting away. I saw that with my own father, who had a lot of loss of muscle mass until he did a little bit of testosterone replacement. Nothing terribly aggressive, but boy, he got a lot of energy back. His mind was sharper, his mood was better. So it really affected him in a significant way. A lot of people don't realize that one of the reasons that women tend to develop frequent urinary tract infections when they get older is that they're lacking sex hormones. And a little bit of progesterone can go a long way in stopping frequent urinary tract infections. And I've talked to a number of providers who have used that treatment method for several years. Hormones aren't the only root cause, though, of some of these mental health problems. Diet can play a significant role. It's not really rocket science to think that the fuel that you put in a tank sort of dictates how the engine runs. And foods that are very nutrient depleted can lead to brain fog and dementia. Too much sugar, for example, leads to what gets nicknamed diabetes of the brain. Alzheimer's disease is nicknamed either diabetes of the brain or diabetes type 3, because when you're eating too much sugar, your insulin level has to progressively get higher and higher, because over time you become resistant to that insulin signaling. Insulin is a growth hormone, so some of the early things that happen when we eat too much sugar are that we gain weight and we start trending toward heart disease, since insulin affects heart cells as well. But over time, as we become more and more resistant to insulin signaling, we get to the point that our body has to produce so much insulin to process the amount of sugar that we're eating that it just can't keep up. And then our blood sugar starts to go up, and then we get diagnosed as a type 2 diabetic. And since insulin is the delivery mechanism that gets sugar to the cells, if we are insulin resistant, it's hard to get fuel into the gas tank, so to speak. And if you don't get the fuel where it needs to go, then things don't fire up very well. And so people can become very, very foggy in the head and can have dementia symptoms. Sometimes when we're helping people improve their insulin sensitivity, their brain really fires up again. And a common thing that we see in long-term care would be someone with Alzheimer's disease getting to end of life and not eating so much anymore. And when you're not eating and you start fasting, your body shifts over into a state of ketosis, where you're burning fat for fuel. And when you burn fat stores, your body produces ketones, which are the only other fuel source that cells can use. So if we're not using glucose because we're not eating anything, but we have some fat stores and start burning fat for fuel, then all of a sudden, the cells of our body have an alternate fuel source. That's why people can live for a long time without food, as long as they have fluids. And often in long-term care settings, I've seen this personally many times myself, people with Alzheimer's who quit eating start to have this little bit of awakening toward end of life. They begin burning their fat stores, and ketones help their brain fire up again, and maybe they recognize family members that they haven't recognized for a while. Or they're a little bit more verbal and a little bit more responsive in some cases. A lot of people are overfed but undernourished, and unfortunately, the standard American diet is very high in sugar. Our grains are sugar, and there's a lot of refined sugar. There's a lot of high fructose corn syrup. There's a lot of processed food that is nutrient depleted. So we need to be very careful about what it is that we're serving people. Quick anecdotal experience with that. I know of an administrator in Idaho who noticed that every time the holidays rolled around, there was an uptick in behaviors. She called it a behavior fest. And as she learned more and more about how diet affects our mental health, she started theorizing that maybe the reason people went off the rails at holiday time was because family members showed their love by bringing a lot of sugar and filling the candy dishes. So she actually went through and encouraged families not to do that. And she emptied out the candy dishes. And since then, as holidays have rolled around, she hasn't seen an increase in the number of incident reports that she was getting related to behavior. So it may be a simple thing that you could try. There are a lot of medications that influence brain health, and some of them have a negative effect. And I wanted to talk about a couple of medications because so many people that we serve are on them. And I'm by no means anti-medication or anti-modern medicine or anything like that. I don't want to give the wrong impression. There's a role for each of the medications that have been approved. But there are some things that we need to take into consideration. So, for example, when it comes to proton pump inhibitors or acid reducers, sometimes they can result in cognitive decline due to malabsorptive disorders. Common scenario would be someone goes to the hospital for surgery. We worry about gastrointestinal bleeding, so we put someone on an acid reducer. And they get through surgery, they discharge from the hospital, and the acid reducer isn't discontinued. And those acid reducers generally aren't meant to be used long-term, because long-term they reduce stomach acid enough that you might be eating dark leafy greens and other colorful vegetables and whole fruits, and lots of good things that are excellent fuel for our bodies. And yet, if you're unable to break them down properly because you don't have enough stomach acid to do it, then you can have some serious issues. You can be magnesium deficient, for example, or deficient in other vitamins that play a crucial role in how the brain functions. I was talking to a psychiatrist a few months ago, and we were talking about the role of nutrients in mental health. And he said, you know, I learned years ago that when someone is incredibly suicidal, where they're just constantly thinking about suicide, if I put them on a magnesium supplement, usually the suicidality goes away, because there's something about magnesium deficiency that affects the brain in that manner. Now, I learned from that. I was unaware of that, but I think that's just one example of how addressing a root cause kind of problem can make a real difference. The gut-brain connection is also crucial to our well-being. And if you go out and look at research on the gut-brain axis, you'll find a ton of stuff out there. The gut is like our immune system, and it's often nicknamed our second brain. Our entire ability to fight illness tends to emanate from the gut. And leaky gut can lead to autoimmunity. Leaky gut is when you have microscopic pores in the gut. And let's say you eat something like a piece of bread that has gluten in it. And if you have these microscopic holes in the gut, gluten can leak out into the bloodstream where it cannot be processed. And if you look at gluten under the microscope and you carefully examine it, you find that it's a string of amino acids. And part of that string looks just like cartilage tissue. And another part of it looks like cartilage. And if gluten gets out into the bloodstream, the immune system will recognize it as a foreign invader and attack it. And when that happens, the immune system says, oh, we've seen that before. And for some people, it'll go attack the thyroid, or it'll go attack joints, and you might get things like Hashimoto's thyroiditis, or you might get things like arthritis. In fact, my business partner has some issues with his thyroid. If he eats a lot of gluten, his thyroid numbers tank, and he's tracked it in the lab. Well, since pain can affect our mental health and can affect behavior, it's helpful to know that. Statins can reduce in pain and can result in pain and cognitive decline. Part of that is that statins don't target good cholesterol versus bad cholesterol, they target all cholesterol. And cholesterol is the major building block of our hormones. And if you're reducing cholesterol in general, then it can cause a major effect with hormones. And the brain is a great big ball of cholesterol, so we need a lot of healthy fat and cholesterol. The body, interestingly, has sensors for all sorts of things in it. Body carefully regulates hormones, carefully regulates electrolytes, but has no sensor whatsoever for cholesterol, which suggests that maybe it's not as important as we're all making it out to be. What's really concerning is damaged cholesterol. We need lots of HDL, but it's our small, dense, and oxidized cholesterol particles that play a role in stroke and heart disease and so forth. And interestingly, one of the major things that causes cholesterol to be damaged, other than general oxidative stress, is sugar. So interestingly, the diet of eating too much sugar may be one of the top things that's leading to an increase in heart disease that we've seen over the years. If people have an undertreated or undiagnosed case of hypothyroidism, that can really affect how they function outwardly. You might have that resident that's just cold all the time, who is lacking energy and has brittle hair, and they seem withdrawn. They don't want to do anything, which sounds a lot like some of these mental health symptoms that we look for. Often when we're checking thyroid, we're looking for one thing. They go off to the doctor and we check TSH, thyroid stimulating hormone. And TSH tells us whether the body wants more T4, which is our storage form of thyroid. Your TSH level can be low, meaning that you're not calling for more T4. But if you're not doing a good job of converting your storage form of thyroid, T4, to your more active, usable form of thyroid, T3, then you can have a situation where your labs look normal, but because you haven't tested things much more broadly and looked at a lot of different aspects of thyroid functioning, you might actually be depleted in thyroid a little bit. And sometimes a tiny little bit of thyroid can help someone have more energy and be more engaged and not be so cold. So it's worth doing a broader panel of labs. I think we probably all know that pain can be a root cause of aggressive behavior, and we need to figure out if someone is in pain. Heavy metals can cause a lot of oxidative stress. And I've seen people that we've worked with that have high levels of lead in their system or mercury in their system. And interestingly, when you have high levels of metals like that, the brain produces more amyloid beta, and it seems to be part of the protective mechanism of the brain. Amyloid beta is what forms the sticky plaques in an Alzheimer's patient. I could tell you a lot of stories related to actual patients in those situations, but we've got 30 minutes for this, so I've tried to cram as much into it as I can. Let's take a few minutes for any questions that you might have.
Okay, and thank you, Eric, for great information. I've put in chat just a couple of things, just one, if you would, please think of a question or two that you have and enter it in chat that we can pose to Eric while we have him, or one idea that you'll take away from today's session that maybe you hadn't thought of before. And so while we've got a couple of, a comment right now from Marlita, who's commenting on her takeaways being the use of sugar for brain fog and the importance of magnesium for suicide prevention. Thank you very much for sharing that, Marlita.
Yes,
yeah. What other kinds of questions do folks have? Please go ahead and put them in chat, or if you've got a long question and your fingers are tired, you can raise your hand as well and Kelly can unmute you. Okay, Pat's sharing that she agrees magnesium levels might be checked for depression as well.
Yes.
Okay. While we're kind of giving you a moment to formulate any questions in your mind, just wanted to announce that I've put a presentation, the presentation link where it can be found on our website, and that will be posted in about 2 weeks or so following this event. And I encourage you to not only have your colleagues check out this session, but all of our posted webinars in our nursing home library. Please share this with any colleagues who couldn't make it today, or use it as an in-service opportunity for staff. So we have a couple questions coming in right now in our chat, so let's go ahead and go through those. And Jeff is asking, what has been your experience in getting the typical skilled nursing facility physicians to order the types of testing that you're recommending?
That's a really good question. And the answer is it's frankly all over the map. It depends a lot on what those physicians have read and what they're comfortable with. Some of them have been quite resistive and have kind of wanted to do things in the way that they've always done it. And many have been very interested, and they've said, you know, I hadn't thought of that. One of the things that we regularly do is to consult with those physicians and give ideas, and when they have concerns, to point them to research that is suggestive of some of these treatment approaches. And over time, if we've been able to talk to some of those doctors and they've been open to conversation, then they've gradually seen more and more insights, and they've been won over a little bit to trying some things that they haven't tried before. One of the key things that can help you in that conversation is to talk about the side effects from so much of the antipsychotic and other medication that gets used. These are drugs that come with black box warnings. Often we're dealing with mental health problems that are comorbid with dementia, and these drugs are not designed to be used in that population. And so if they're a little bit gun shy about a different approach, when you're talking about the risks of antipsychotics, and you say, well, I'm trying to do some things where we don't have to go down the antipsychotic road. Could we try a trial of this or that? Often that causes them to open up a little bit. So thank you. That's an excellent question.
Great. We have a question from Robin asking, how many grams of sugar a day is okay?
That is a great question. And you'll find some answers that are over the map. And one of the researchers that whose work that I've read said, basically, there's more sugar in one can of soda than the body should have in a full day. Now, that said, I believe there are very different ways of looking at sugar depending on where it's coming from. Let's take fruit, for example. If you juice a fruit, you remove all the fiber. And if you give someone apple juice, their sugar is going to go up real fast if you're checking their blood sugar. That's why when someone's diabetic and their sugars are bottoming out, we give them a glass of juice. But when you eat a whole apple and you get all that fiber with it, it slows down the release of sugar. So not all sugars are created equal. Beans, for example, are super high on the glycemic index, but they have so much fiber that the sugar load on the body is very, very low. And they're not going to stimulate a massive insulin response. So it's a tricky question and difficult to answer without a lot of nuances.
Yeah. Okay, we have a couple of comments. Skitch mentions you can't separate psychological from physiological, that they're interwoven, and Pat thanks you for the interesting suggestions. And then Deborah commented that she was always afraid of what hormones would do to a person concerning cancer. So the lack of hormones is interesting to her.
Yes, the Women's Health Initiative study years ago showed that women who were using those hormone replacement methods had an increased risk of cancer. And unfortunately, that study was done with Prem-Pro and Premarin synthetic hormones, which don't really look like what your body produces. And there's a growing body of evidence that bioidentical hormones that do look exactly like the body produces are treated differently, particularly when you're using a cream that's applied topically. But definitely, it's not something to be taken lightly, and nobody should go out and just randomly prescribe hormone cream without taking into account someone's family history of cancer, someone's individual history of cancer, and it's not necessarily an easy decision to make. So good point there.
Okay, thank you. I'm going to give us all about another 10 seconds to think of any final questions that you just can't wait to have answered. And while you're potentially doing that, I'd want to invite folks to join us again on March 8th for our next hot topic, which is going to be on dementia, delirium, and their behavior disorders. So, and I'd like to remind those of you who are New Mexico teams to make sure that your name and email of all attendees are entered into chat so that we can send you a continuing ed test link early next week. So let's see, are there any going once, going twice, any final comments or questions? Okay. Not up. Jeff West is asking for any links to other related resources. So if there are any resources, Eric, that you can think of, we would certainly love to maybe hear from you on that, and maybe I can have Brent from Idaho just follow up with you on that to just, if there's anything you can point us in the direction of that would be helpful, we would certainly welcome any kind of resources or information from you. So,
sure, yeah.
All right, so I would like to say again, once again, thank our presenter, Eric Collett, for amazing information today. We're very excited to have you. I want to thank all of you for joining us for Hot Topics and release you back to your Friday. So thank you. This is the conclusion of our Hot Topics webinar for today. Have a great weekend, everyone.